a group of about 65 undergraduate and graduate as well, state certified EMTs. So we're equipped to respond to any medical emergency that occurs on Penn's campus. We serve not only Penn students, but also anybody traveling through the Penn community and faculty and staff and etc. About 45% of our calls are alcohol related, and those often, as you might expect, occur on the weekends, but then during the week it really varies. Our initial assessment is the same. First, we address any life-threatening issues. So obviously our primary concern is to make sure the patient's alert and oriented and able to tell us, their name, where they are, all of that, and that they're breathing appropriately, and that their circulation is okay. So that does not differ for any patient, because those are all life-threatening things. And then after all of that is stabilized, hopefully, then we'll start looking at the secondary symptoms, if there are any. So for alcohol, symptoms can range from falls. So we'll obviously need to control for bleeding and any other traumatic injuries from a fall. Head injuries are a big one we're always concerned about, because especially if someone has an altered level of consciousness from intoxication, they won't be able to tell us that their head is hurting, or they won't know they fell. So we're always overcautious about that. Another thing is other diseases they have. So we always ask about past medical history or any medications they're on. So sometimes diabetic emergencies can look like intoxication. They'll be very sleepy and kind of out of it, or they'll get very sick and have a decreased level of consciousness. So sometimes that can just be thought of as intoxication when it's really not. So it's also important to look at somebody who has other diseases or other past medical history that could contribute to it.
And another thing going off of that is we always ask when people last ate, which can be especially relevant if you're a diabetic and you've been drinking and then you threw up. So just like we were saying before, just getting the whole picture and things like that.
Mm-hmm. When they're showing outward signs of intoxication, or when their primary complaint is intoxication, or for any other, injury not alcohol related, where they're requesting transport to the hospital or definitely need transport to the hospital. So in the case of alcohol, anybody who has outward signs such as stumbling or slurred speech or a decreased or altered level of consciousness, fall victims, vomiting's a big one. Any time there's an outward sign or somebody reports being intoxicated, our protocol does not allow us to have them refuse our care, because they don't have, or they probably don't have proper judgment, with alcohol. So we end up calling for transport. I think medical amnesty is essential on college campuses like Penn. I think it encourages people to call for help when they need it, and a primary concern of theirs, instead of being disciplinary and that they're going to get in trouble for underage drinking, is instead, I'm sick, I need help, I'm going to call for help, and this is for my health. So I think medical amnesty definitely encourages people to call when they do need help, and I think it also, since it does cover friends and other people that are seeking help for another individual, I think that's also really important, because friends are never concerned they're going to get in trouble just by trying to help somebody else out. MERT is a purely volunteer organization. We don't receive any compensation for our services, and that means we don't bill patients at all. So if you call MERT, you will not be receiving any bill from MERT. Where the potential bills do come from, though, are the transport agencies that will take you to the hospital if you need hospitalization, and then ultimately the ER. So that's where the myths that it costs thousands and thousands of dollars to be MRDed ultimately stem from. We obviously want to dispel them and just have people know that it's not MRD that's billing. And at the end of the day, most insurance plans do cover ER costs. So although the bill is probably in the thousands, it's not what you're that's not at all what you're paying out of pocket at the end of the day.